So to begin with, I would like to understand from you the role of intravascular imaging in PCI and what are the benefits.
Well, I think there's a lot to say about intravascular imaging in PCI. I think we can start off by saying that it's probably underutilized in coronary intervention. There's many benefits in terms of lesion assessment and characterization of plaque, as well as assisting in device sizing and selection of various devices. There's been an abundance of data, particularly in 2016. Quite a bit of data has come out recently suggesting that both intravascular ultrasound as well as optical coherence tomography greatly enhances the outcomes of PCI and perhaps is better than angiographic guidance.
So, sir, what are your key messages for practitioners for coronary lesion assessment?
Yeah, I think the key take-home messages include that we should be using more intravascular imaging. That despite our years of experience and practice as interventional cardiologists, angiography still fools us sometimes, and I think having a low threshold for using intravascular ultrasound, particularly in complex lesion subsets, left mains, bifurcations, multiple overlapping stents, and so forth, is important. I think this becomes even more important as we move into the era of bioresorbable stents. That absolute lesion assessment, absolute fidelity of the lesion assessment is important. I think the other important take-home message is that there is a lot of data. I heard during some of the sessions some doubt as to whether the data would really support the use of intravascular imaging, and there's been quite a bit of data. Even in 2016, some studies have come out supporting this notion, and so the practitioner, I think, should familiarize himself or herself with some of the newer data that's coming out.
Okay, so sir, how do you feel what will be the future of the intravascular imaging in countries like India?
Yeah, I think a lot of it depends on payment and the acquisition cost of many of these devices. This is true in the United States, where I practice as well. In the United States, we don't have a designated reimbursement for this, and so I think that's one of the reasons why it's underutilized. Whereas in countries like Japan, 80% of the PCIs are performed with intravascular imaging guidance, and there is reimbursement for it. So I think it helps the practitioner make the right choice with that. In India, as the type of coronary work is becoming increasingly complex, I've seen some unbelievable cases presented at this meeting from around India, as more and more complex PCI is being undertaken in centers across the country. I think that intravascular imaging should have a bigger and bigger role in India.
Right, sir. So apart from the cost, what would be the major barrier for usage or under usage of this?
That's a great question. I think that cost is an important one, but interpretation of the data in real time is another important barrier, meaning if you generate the data, you have to be prepared to interpret it on the fly and incorporate it into your treatment strategy. So familiarity with the information that it yields is another important hurdle that practitioners have to get over.
Okay. So thank you so much, sir, for your time and valuable insights, sir. Thank you so much.
Thank you for having me. Coronary intervention. There's many benefits in terms of lesion assessment and characterization of plaque, as well as assisting in device sizing and selection.